Hi, my name is Kaitlyn Tenn, and I'm currently a rising senior at Florida State University majoring in biochemistry. This summer I had the pleasure of working with the SURF program under the College of Pharmacy's Medicinal Chemistry department in the Changlong Li lab group. My project focuses on targeting the IL-6 GP130 protein-protein interface in the treatment of autoimmune diseases such as multiple sclerosis and rheumatoid arthritis and different cancers. To begin, I'll start by discussing some of the relevant background information for the project that I've been working on this summer. The compound that I've been synthesizing targets the interleukin-6 GP130 hexameric complex. Interleukin-6 is a cytokine that is produced by all cells of the body and is responsible for eliciting an immune response by promoting the differentiation of lymphocytes as well as promoting cell growth and survival. Interleukin-6 is constantly present in the body. However, when the body is subject to injury or infection, interleukin-6 levels become elevated. In order for interleukin-6 to initiate an immune response, it must first form a hexameric complex consisting of two IL-6 cytokines, two IL-6 alpha receptors, and two GP130 signaling receptors. The first step in the formation of the hexamer is the formation of the IL-6 and IL-6 alpha receptor dimer. It is important to note that the IL-6 receptor exists as both a soluble form that circulates throughout the body and as a membrane-bound form found within the cell membrane of select body cells. Thus, IL-6 has the potential to stimulate a wide variety of different cell types within the body. This does not occur all the time, however, as IL-6 exists normally in low concentrations in the body and will bind to the readily available soluble IL-6 receptors rather than the membrane-bound IL-6 receptors. But when infection is present and IL-6 levels increase, the number of IL-6 cytokines will exceed the number of soluble IL-6 alpha receptors, and so IL-6 will bind to the membrane-bound receptors to initiate immune responses in affected cells. The second step in the formation of the hexameric structure is the formation of the trimer, which occurs when the previously formed dimer binds to the GP130 protein. The final step in the formation of the hexamer is the binding of the two trimers. The newly formed hexameric complex can now initiate a signal transduction pathway that can be used to initiate an immune response. Autoimmune diseases such as multiple sclerosis and rheumatoid arthritis are characterized by heightened immune system activity. This has led researchers to investigate the role that IL-6 plays in such diseases. Based on studies performed, it has been found that those affected by autoimmune diseases have consistently high levels of IL-6 in their bodies, resulting in constant antibody production. Additionally, overexpression of IL-6 is seen in cancer patients. The overexpression of IL-6 in cancer patients is linked to the proliferation and survival of tumor cells. In the Li lab group, we have been working on synthesizing a novel compound to treat those affected by autoimmune diseases and cancer. This compound targets the aforementioned IL-6 GP130 hexameric complex. Like I said before, the hexameric complex is necessary to initiate an immune response, so this novel compound attempts to block the Site 3 protein-protein interaction to prevent the formation of the active hexamer. Without the formation of this hexameric complex, the body cannot elicit an unwarranted immune response despite the high levels of IL-6 exhibited by these patients. Over the course of these 10 weeks, I've been working on completing the synthetic route for the LLM-414 compound through a series of different chemical reactions. I had the opportunity to use techniques such as TLC, mass spectrometry, and hydrogen NMR to verify the presence and identity of my compounds. I worked on refining the chemical synthetic routes to produce the highest yields possible and saw promising results in many cases. To summarize, this summer I had the pleasure of working with the Li lab group to synthesize the novel compounds LLM-414 and LLM-418. These compounds will be used to treat those affected by autoimmune diseases and cancer. These compounds work to antagonize the effects of the higher than normal levels of interleukin-6 exhibited in these patients by preventing the formation of the vital hexameric complex consisting of the IL-6 cytokine, the IL-6 alpha receptor, and the GP130 protein. This summer would not have been made possible without a few people. First and foremost, I would like to thank Dr. Changlong Li for allowing me to work in his lab. Additionally, I would like to thank my PhD student mentor, Daniel Schultz. Dr. Lee and Daniel truly took me under their wings and really made sure that I made the most out of my summer experience at the University of Florida, always making sure that I understood everything that I was doing and why. I would also like to thank SURF program directors Mike Nazareth and Julissa Nunez. You guys truly made a family out of everyone in this program in 10 weeks, and I can't thank you enough for making our stay at the University of Florida so comfortable, informative, and fun from start to finish. Finally, I would like to thank the University of Florida and the University of Florida Provost for funding this program and making this all possible. The University of Florida is truly amazing, and as a Seminole I don't say this lightly, but go Gators!